In today's health headlines, there has been a generational rise in 17 cancers for millennials and Gen Xers, how blood tests for cancer detection work, and what we can do to lower our risk of cancer in general. Joining us is medical oncologist and co-director of the colorectal program in the Center of Gastrointestinal Cancers at Yale Cancer Center and Smilow Cancer Hospital, Dr. Michael Cecchini. Doctor, thank you for being here. We appreciate it.
Thank you so much for having me today.
All right, listen, new research from the American Cancer Society found that millennials and Gen Xers are more likely to get cancer than older generations. Do we know why that's happening?
Well, we don't. I think we've historically defined early onset cancers as cancers less than the age of 50. We've known for several decades now that there's been a rise in incidence, rising number of new cases per year in this age group. But we frankly don't know why it is. We know that there must be some lifestyle, some environmental factors that is driving this, but exactly which of those is driving the major driver, we're still doing a significant amount of research to try and uncover that. We think there may be some things about sedentary lifestyle, obesity, chemical exposures. We know it's not all driven by genetics. Those things aren't changing in our younger individuals, but it's certainly something lifestyle, environmental. A lot of work trying to undergo that's going on to try and figure out exactly what that might be, though.
Interesting. There is a new blood test to detect colon cancer approved just this past week. How does that work, and do you recommend that test?
Yeah, just earlier this week, the FDA approved a test called Guardant Shield by the company Guardant. It's a blood test that basically looks at patterns of DNA that might be circulated in the bloodstream to try to detect a signal if there's an evidence of a colon cancer or maybe even a precancerous lesion in some circumstances. I think it's always welcome news to have a new screening test, and screening and making a diagnosis early is absolutely key. I think we need more work for this specific test to know whether or not it's actually reduces mortality, reduces the new incidence, and kind of in a broad population. But the fact of the matter is, in the population that we recommend screening for, we're only screening 2 out of 3, 2/3 of the population. We need to increase we need to screen everybody that should be screened. And so if this test is going to help address patients that are not otherwise being screened by methods such as colonoscopy or stool-based testing, I think that will be certainly beneficial. Frankly, the right screening test is the one that somebody's willing to do. So right. Traditionally, again, we've been doing colonoscopies and stool-based tests, and I think this is an added strategy and will hopefully improve screening rates overall.
Along with screening, what else should people keep in mind to help lower their risk of cancer in general?
It's a great question, and even though we're saying aside from screening or besides screening is still so important. So we still got to say screening's the number one thing to do. But as we kind of started the segment talking about, we don't really know what's driving this early onset. We know things like obviously things like obesity, sedentary lifestyle are not helpful for numerous health factors. So I think improving our diet, reducing ultra-processed foods is certainly helpful. But the fact of the matter is we don't have high-quality evidence to say, okay, if you eliminate those things, your rates of colorectal cancer are going to plummet. But for many reasons, I think healthier eating, activity, we do know that it reduces the recurrence risk to have some degree of exercise after resection of colon cancer in the first place. So I think people stand to benefit from just being healthy and more active in general. Yep. And the other thing is to also just alert your doctor if you're having symptoms, change in bowel habits, bleeding, fatigue that's unexplained, abdominal pains that aren't explained, to make these diagnoses early and have a discussion with your doctor about what testing may be indicated.
Good advice, Dr. Michael Cecchini from Yale. Appreciate your time. Have a great weekend.